But for now, I'd like to start by welcoming you and thanking you for giving up your valuable time and interest in studying with the MSc Clinical Health Psychology. So I'm Damien, and I am the program lead, at least for this year. This is the final year that I'll be the program lead, and then I will be taken over by one of our other colleagues within the Department of Psychological Sciences and Health, and I'll show you a picture of her, Joanne, as we go through some of the slides. I'm joined today by Sammy, who is a member of the recruitment team. That's right. I'm never sure if it's admissions, recruitment. It's different language used in different institutions, but remember the recruitment team. And so Sammy and I are often in correspondence when she's making the selections for people joining the course to make sure that the people have got the right academic qualifications and requirements, and if things are slightly different for international students, making sure that people are at the right level to join us, because the last thing we want is for people who perhaps don't have the right background to join us, because it won't be fair on them, because it'll be a lot harder than it needs to be. So we're often in correspondence to make sure that the right people get on the program that can benefit the most from it. So I'm just going to share my screen, and as I said earlier, it's the same 13 people in, but if you've got any questions, put them in the Q&A. I can see there are 5 items there. I haven't had quite had a look at them yet. I might address them as I go through, but we'll deal with them in the final 20 minutes or so that I've allocated. So hopefully I will get through as planned. And then, there we go. So everyone should be able to see my screen now. You can see Sammy nodding, so that means everyone should. So because we started at 5 past, the welcome has just gone over slightly, but for about the next 30 minutes or so, I'll give an overview of the program. That will probably address some of the questions that you've been putting in the Q&A. That's fine if any of them are outstanding. We'll deal with them in the last 25 minutes or so, where that's just an opportunity for you to ask questions about the program to me, and then other matters. Sammy will be able to address those with regards to recruitment, etc. So, as I said, I'm the program lead. This is my final year that we're currently in. Dr. Joanne Cummings, who's currently the program lead for our BA Psychology within the Department of Psychological Sciences and Health. She'll be taking over from me next year. So if you join us in the academic year 25-26, Joanne will be leading you throughout your time with us. I'll still be on the teaching team, but I'll be less of a visible presence, and Joanne will be the go-to. But I'm here today because I've got all the experience of the last 3 years to be able to share with you. And so the first place to start is getting on the program. You'd have probably seen this on the web page and been contemplating, when contemplating your application. A first or upper second class honours degree in psychology from a UK university, or the overseas equivalent. So for UK psychology degrees, the vast majority will be BPS, or British Psychological Society accredited. So if you've got a BPS accredited degree that's first or second class, then you'll fulfill that requirement. For international applicants, we're looking for obviously a very strong degree, but we're also looking in psychology. So you must cover the equivalent of the core BPS curriculum, which you're not to worry about. You can ask questions of Sammy and I about that, whether your current program meets that. So that's for international students, but you must have done a statistics class or module. Okay. You must have done a research methods class or module. Okay. And if it's a research methods and stats class, that's fine, but you must have done these, and you must have also done a research project or a dissertation or a thesis. Okay. So in addition to a broad coverage of psychology, our international colleagues must fulfill these 3 criteria as well. Okay. As well as then the requirements for the English language. Okay. And I'm not involved in the English language, any aspect of English language requirements, and Sammy will be in a better position to ask any or address any questions on that. Okay, so that's the academic requirements and experience required for the MSc in clinical health psychology. And if you've got any questions about your specific situation, then don't hesitate to contact the Study with Hass website, email address, or at the end of this presentation, I'll show you the program leader's address for the MSc Clinical Health Psychology. So there's a specific email address for inquiries about the program, the academic issue, any academic issues. Okay, so that'll be the final slide of this presentation. So the aims of the program are to prepare you for an applied research or professional psychology career. So lots of people do the MSc in clinical health psychology because they're interested in pursuing typically a career in clinical psychology, but there's also applied psychology careers in health, neuro, counseling, and other people go on to do PhDs or do the clinical associative applied psychology. So there's lots of applied and research-based sort of opportunities after completing the MSc, but there are a few more hoops that you have to jump through if you want to go on to do the professional doctorate training. And I can take any questions on that if necessary at the end. To provide you with an intensive teaching and research environment covering core areas, applied areas of professional psychology, and I'll go through the curriculum over the next few slides, but it is an intense program, okay? The university will expect you to work each week somewhere in the region of 40 hours. Okay, so it's like having a full-time job. Okay, now that might not necessarily be Monday to Friday. People work weekends. We've also tried to structure our programs so that there's no teaching on campus on a Monday and a Friday. So that means that some people get voluntary roles to help develop their CV and develop their skills and applying their knowledge and skills. Some people, out of necessity, have to get paid employment in order to help pay for their studies, etc., etc. So we try and keep Mondays and Fridays clear, but then I'll show you the timetable as well. So we only teach on a morning or afternoon on the Tuesday, Wednesday, and Thursday, and I'll show you that. But it is intensive, okay, particularly for those doing the full-time program. Provide an introduction to key psychological interventions via practitioner-led workshops. So we have external practitioners from the NHS and private practice come in and deliver workshops on particular core psychological therapeutic modalities. Okay, that's one of the modules, one of the 6 taught modules, and help to develop communication and reflection skills. Okay, so that's the aims of the project. In terms of some of the teaching staff, the class leads, so I said there are 6 taught modules. So the class leads for those are Dr. Nicola Peddy for clinical psychology, Dr. Irina Campbell, who's also the deputy program lead, so is my deputy, and will become Joanne's deputy as of next year. Irina also is the class lead for the professional practice class and the introduction to psychological therapies class. Okay, I lead the research methods class. We've then got Dr. Megan Crawford, who leads the health psychology class, Dr. William McGowan, who leads the neuropsychology class. So that's the 6 taught. And then obviously the final class is the dissertation. Okay, and that's led by Dr. Craig Donaghy. We've also got other members of the teaching staff. So we've got Professor Paul Flowers, who teaches on the health psychology class, Dr. Alia Raymond, who teaches on the clinical psychology class, Dr. Kirsten Russell on the clinical psychology class, and then Professor Chris Graham on the introduction to psychological therapies. Then, as I said, the incoming program lead is Dr. Joanne Cummings. So you'll be able to recognize her when you see her on campus if you join us in September. So there's Joanne. So that's the teaching team. We have a variety of backgrounds: health, neuro, clinical. My background is in public health psychology. We've got quantitative researchers, qualitative researchers, mixed methods researchers, people from areas of physical health, mental health, environmental health. All manner of specialities and skill sets are captured within that relatively small but tight team. So what you'll study, so we've got the applied psychology topics. So we've got a module in clinical psychology, a module in health psychology, and a module in neuropsychology. We've also then got a module on professional practice. So that's designed to enhance your knowledge of professional and ethical issues, including sort of legal requirements. We've got the research methods class, which is my class, and that provides a mixed methods overview of key approaches to research, design, and analysis across clinical health psychology. We've also then got the introduction to psychological therapies, which, as I alluded to in the earlier slide, is a series of practitioner-led workshops on key therapeutic modalities, and that's for one of the modules. And then we have a dissertation. So you will, before you join us at Strathclyde in September, Dr. Donaghy would be in communication with individuals who have accepted their offers and will be joining us to select your dissertation topic. So there'll be all the supervisors and their dissertation research areas. They'll be sent out, and then you are to identify your top 3 dissertation supervisors / subject areas. Okay, and that can be on any topic related to clinical, health, or neuropsychology, and that's very broad. There's obviously a full-time and a part-time option for the MSc. International students, the only option you'll have is full-time option. Anybody who's choosing, obviously, the full-time option, who's a home student, this is what it will look like. So in semester 1, we have 20 credits for clinical psychology module, class, professional practice class, and the research methods class. In semester 2, we have the 20 credits health psychology class, introduction to psychological therapies class, and the neuropsychology class. And then we start the dissertation from week 1 of semester 1, and it goes all the way through until the end of June, beginning of July, when the submission deadline, when the submission deadline is. Okay, so we're working on the dissertation from the earliest possible point in your time with us on the MSc. So that's the full time. In the part-time, it's a 2-year part-time. It looks like this. So anyone who chooses the part-time, in year 1, in semester 1, you'll do the clinical psychology class and the research methods class. In semester 2, you'll do the health psychology class and the neuropsychology class. Okay, so that's it. So there'll be nothing during the summer, and the other grayed out classes you'll do in year 2. Okay, so in year 2, you'll just do the taught professional practice class in semester 1 and the taught introduction to psychological therapies class in semester 2. And at the beginning of semester 1, you'll start your dissertation project, and you'll work right the way through until June or July of that year. Okay, when the deadline is. Typically, in most years, it's the end of June. This year, the deadline's the end of July. So we go by the academic calendar, and so it always falls in week 48 of the academic calendar. This year, week 48 is the first week in July. Last year, week 48 was the last week in June. So that's why I'm saying the end of June, beginning of July. Okay. So the timetable, as I said, we try and ensure that Mondays and Fridays are clear. Now, if there are occasions when, because external staff come in from the NHS and private practice to do psychological therapies workshops, sometimes they are only available on a Monday or on a Friday. Okay, typically a Monday. So there might be occasions, depending on their availability, that there's something on a Monday, but by and large, Mondays and Fridays are clear, but you'll be notified well in advance of beginning semester 2 if there are any changes, but also things might change due to ill health. So there has to be a bit of flexibility, but the plan is keep Mondays and Fridays clear. And then in terms of when the teaching typically takes place, and again, subject to change, because it all depends on room availability, staffing issues, etc. But we always ask for clinical psychology in semester 1 to be taught on a Tuesday morning, professional practice to be taught on a Wednesday morning, and research methods on a Thursday afternoon. And then in semester 2, health psychology is taught on a Tuesday afternoon, Introduction to psychological therapies on a Wednesday morning, but as I noted, there could be some flexibility with that, but you'll be informed of that. And then neuropsychology on a Thursday afternoon. And then the dissertation, the main staff contact or campus time will be through weekly or fortnightly, every 2 week supervisions with your dissertation students, so dissertation supervisors. So that will be agreed with them at the time. So that's sort of to be determined with your supervisor. All the information about each of the classes that I've just gone through, the 6 taught and the dissertation class, as well as a core page, is through our is delivered through our virtual learning environment, which is based upon Moodle, but it's called MyPlace. And here I've taken a screenshot of the program page. So we've got sort of, meet the teams. There's links and photos to each of the team members that you've already met. Induction details. So details of the induction takes place in Welcome Week or Freshers Week. Program materials, so the handbook, timetable, etc. We have a pastoral support system, so we tell you who your pastoral support tutor is, etc. So core sort of general details are captured on this page, but each of our modules has got their own MyPlace page with all the details with regards to learning materials, timetables, assessments, etc. So everything is found on MyPlace, our virtual learning environment. Okay. In terms of assessment, so we take what's referred to as a patchwork approach to assessment. So we've got different assessment types for each of our modules. So for clinical psychology, we've got a case conceptualization, which is effectively a formulation. In professional practice, there's a case study around the application of professional and legal issues. Okay. In research methods, there's a piece of group work, and it's about developing an evaluation of a clinical health psychology intervention. Health psychology, you're creating a behavior change leaflet, a theoretically informed behavior change leaflet in the area of medication adherence. In Introduction to Psychological Therapies, we've got a reflective essay. So you reflect upon the skills that you have developed in one of the workshops. Then in neuropsychology, there's a presentation and a poster. And then for the dissertation, there's a presentation and a thesis that is submitted. So you can see there, all 7 of these classes have got different types of assessment attached to them, which are referred to as authentic assessment. So they tap into the key skills and application of knowledge that you'll require post-graduation. Okay, so when you become, go to do a PhD or go on to study, train, and practice as a clinical psychologist, health psychologist, clinical associate in applied psychology, etc. Okay, so I'm just going to go over, I'll provide an overview of the classes for semester 1. Okay, then I'll go semester 2. Or you'll be able to get hold of these slides. You'll obviously get the video, so I'm not going to read everything out on the slide. It's there as a resource for you to have, and you'll be able to pause the video to read the slides in greater details. But I'm just going to briefly go over some of the key aspects. Okay, so in semester 1, as you know, you've got clinical psychology. The aim is to deliver a theoretical and evidence-based introduction to the field of mental health and its relationship with physical well-being. Here's the class timetable. It's subject to change. You can see it's delivered in 2-week blocks, and so there's a number of conditions that are addressed. So we've got the relation between physical health and mental health, insomnia, psychosis, mood disorders, and trauma. Okay, so that it's delivered in 2-week blocks. The assessment is the case conceptualization essay, and that's worth 100%. So there's 1 piece of coursework. For professional practice, is to introduce the core professional and ethical and legal responsibilities as identified by the professional bodies. So that includes the British Psychological Society. The HCPC is the Health and Care Professions Council, which if you become a clinical psychologist or a health psychologist, a practitioner psychologist, you have to be registered to the HCPC to be able to practice. And also the NHS. So each of these bodies have their own professional, ethical, and legal requirements. And so this module gives an overview of those. In terms of the way in which the class is structured. Again, it's in 2-week blocks. So in blocks, in the first block, you look at professional guidelines and evidence-based practice. The second 2-week block, confidentiality and risk assessment. The third 2-week block, professional boundaries and anti-discriminatory practice. The fourth 2-week block is around supervision and CPD. And then the final block is on public protection and information sharing. Okay. This is the timetable, the different types of materials and content across the weeks. The class is a case study, a reflective case study essay. It's worth 100%, so there's one piece of coursework. Research methods, so it's to provide an awareness and critical appreciation of the research methods employed in clinical health psychology and an understanding of their use within evaluation activity. So this goes beyond the psychological research methods that you will have covered or will be covering at undergraduate degrees. So we bring in mixed methods, we bring in epidemiology, we look at things like randomized controlled trials, cohort studies, case control studies. We focus in on qualitative research, particularly around thematic analysis. And then we also have an introduction to evidence synthesis, like systematic reviews, etc. So it goes beyond the types of research methods you're likely to have been exposed to at undergraduate level. You can see here some of the issues that I've just alluded to within the weekly timetable. So rather than be delivered in 2-week blocks, this is delivered in 1-week blocks. And you can see there what those weeks look like. There are 3 elements of assessment, because as I alluded to earlier, the main element of assessment is a group report. So you'll get allocated to groups of 4 in week 1 of the semester, and then you work together every single week. Every week there's a tutorial, and in those tutorials, the groups work together. So you start to develop rapport, start to understand, your team members, how they work best, what you need to do to support each other, etc. And then at the end of the semester, you put in a group piece of assessment. But because that's a piece of assessment split between 4 people, so everyone gets the same grade, there are also some individual aspects of assessment which comprise 40%. So you'll be working on your own for 40% of the assessment, and with 3 other members of a group for 60%. Okay. Moving on to semester 2, we've got the health psychology class. So the aim is to enable students to develop their knowledge of health psychology and acquire and practice the skills required to develop and critically evaluate health psychology interventions to change health behaviors and improve health outcomes. This is the timetable. So again, this goes back to 2-week blocks. So you're looking at the relationship between behavior and health, theories of behavior change, developing behavior change interventions and techniques, then looking at interventions and techniques in the real world, and then finally looking at adherence to interventions and techniques. So this is a scaffolded approach towards the development of a behavior change leaflet, which is the piece of assessment required of this. You actually create the leaflet, so 1 page of A4, double-sided, but then you also have to write an accompanying report that justifies the design of your leaflet and also the theoretical basis of your leaflet. Okay, so that's the assessment for health. Introduction to psychological therapies. It's a series, as I said, series of workshops on key therapeutic modalities employed in psychological practice. It's in 2-week blocks, and so you have a block on counseling skills, a block on motivational interviewing, a block on CBT, a block on mindfulness, although I think moving forward, mindfulness is going to be swapped out for ACT, so acceptance and commitment therapy, because Professor Chris Graham, who joined us fairly recently, is an expert on ACT. So we're going to tap into his skill set there, and then looking at interview skills. And the one piece of assessment for that class is a reflective essay reflecting on a key skill or key competency that you've developed in the workshops. Okay, so as you know, for anybody who's interested in going into clinical psychology, health psychology, the practitioner psychology roles, one of the key competencies is reflective practice. So you're developing that awareness of reflective practice through the assessment, remember, authentic assessment, through writing reflective essays. Okay, so you're developing your skills and competency around reflection. The final taught class in semester 2 is neuropsychology. The aim is to provide you with the knowledge and skills relating to neuropsychological assessment across a range of medical conditions and knowledge of a range of medical conditions with regards to underlying neuropathology and the cognitive and behavioral symptoms. So neuropsychology as a practice is a specialism within clinical psychology, but there are non-practitioner psychologists who work in the area of neuropsychology as well. Okay. So if you want to go on to become a neuropsychologist, a practitioner neuropsychologist, you would need to do clinical psychology first and then specialist training in neuropsychology. Here is the timetable. We revert to this Thursday afternoon class, again, just like my research methods class, a weekly timetable. So each week there's a new topic or a couple of different topics, but it's not done in a 2-week block. It's done in weekly blocks. And you can see here some of the issues: neuroanatomy and cognitive architecture, neuropsychological assessment, normal aging, Alzheimer's disease, mild cognitive impairment, frontotemporal dementia, stroke and vascular dementia, schizophrenia. Then there are some guest lectures, and these typically focus on neurodevelopmental conditions like ADHD and autism, dyslexia, etc. But those are determined at the time. Okay. The assessment for this is a group presentation. So it's only worth 5% because the feedback you get on the group presentation can be used to improve and develop your individual assessment, which is a information poster. Okay, so the topic that you select for the group presentation as a group is the one that you will do your poster on. Okay, so there's group work involved, but you'll get feedback which can then help with your individual element of assessment. Okay. Then finally, the dissertation, and I must say that the dissertation, I forgot to update this because it was a change to the dissertation lead midway through this current academic year. And so apologies, I've left. Previously it's Dr. Leanne Fleming, it's now Dr. Craig Donachie, so apologies for overlooking that. The aim is to enable students to apply the knowledge and skills that they've acquired within the taught modules, and even from undergraduate and from independent study to a research project in order to demonstrate professional and independent working, which will help enhance employability skills and allow you to refine your academic report writing and presentation skills. Okay, it's fairly flexible. There are a number of dissertation offers on option. So you can do primary data collection. That could be quantitative or qualitative or mixed methods. Secondary data collection. So that's about using a data set that's already been collected and going into a deep analysis of that. That could be qualitative or quantitative. Or, as I said, there's evidence syntheses or systematic reviews, and they can be qualitative or quantitative. Okay, so there's quite a bit of flexibility in terms of the methodology, and there's also some flexibility in terms of the topic or subject area that you'll be doing this in. The assessment, there's an oral presentation that's worth 20% of the mark, and we did those just the other week, so that's done in February. You then get feedback, and that's focusing on the introduction and methodology or the method sections. You get feedback early on your introduction and method, and then in the sort of end of June, beginning of July, you then submit a thesis, which is worth 80% of the overall grade. And that's in the form of a journal article, and that can either be 5,000 words for quantitative project or 6,000 words for qualitative and evidence synthesis projects. Okay. In terms of the assessment schedule, we have our deadlines and resit assessment deadlines set out in advance. This is from 24-25, so the current academic year. They'll obviously be different for next academic year, but they'll be made available to you in the welcome week, and it will be on that MyPlace webpage under the program, like key program documents. But we try to have one deadline per week for semester 1. So you can see this is week 11, 12, and 13. Then we have the winter break. Okay, you do your resits early in semester 2 so that you can get them done and out of the way. Again, we have spring break at the end of semester 2. So we do the 11 taught weeks, Then there's a 2-week spring break, and then you come back. And after the spring break, you've got health submission. That's week 12. Introduction to psychological therapies, week 13, and then neuropsychology. Obviously, there's the small presentation just before spring break. And then in week 14, sorry, after the spring break, there's the poster presentation. Okay, so the oral presentation before spring break, poster presentation in week 14 after. So we spread the deadlines out, no more than one per week. You have the resit deadlines available. And then there's the dissertation submissions. Okay. So coming to an end, and I'm actually, surprisingly for me, I'm on time. It's going to be within half an hour. So that's the sort of like the academic side, the classes, the assessments, the timetable, etc. Then there's the support and opportunities. Okay, so the program has a pastoral support scheme. So everybody who joins us gets allocated to a member of staff as their pastoral support tutor. And so they can then assist you with non-academic things. So I'll say in the past, my pastoral support activities has included people with accommodation difficulties, experiencing sort of health difficulties, and signposting to the well-being service that the university offers, offering alternatives, perhaps voluntary suspension, so taking some time away from study, voluntary withdrawal if that's appropriate because you're not able to engage with study. So there's a lot that the pastoral support tutor can do to support during difficult and challenging times, but also during good times. So last week I had a meeting with a student who wanted to just share with me their plans for when they'd passed, and graduated from the MSc, and how they wanted to go into a specialism called psycho-oncology. So working with oncology patients, cancer patients, from a psychological perspective. So we sat down looking at opportunities where there might be training, where there might be research opportunities, how to develop the CV in that way. So the pastoral support tutor is there in the challenging times, but also, to share good things with them and for planning. We also then have staff student liaison committee. So we held one of those last week, and this is an opportunity for students to feed back to the staff problems, or even to say, things are going well. It's always nice to hear when things are going well. But when we're told that there are issues, we can then try and get support from the faculty or from the university to try and address those issues. Or if it's things that we can do within the program, we'll do them as soon as possible. So for that, we invite people to become program reps. So the program reps, that's something to put on your CV, but the program reps work closely with the program lead to iron out some of the issues, to create opportunities, etc. There's the Postgraduate Psychology Society. So there's a whole committee that has to be reconvened every year. So, various committee roles that people apply for, they go on your CV. You then get the opportunity to organize social events, to organize, employability events, like having practitioner psychologists give presentations. This year, for the first year, the Psychology Society are organizing a postgraduate ball. We've not had that before, but the Psychology Society have wanted that for the postgraduate community. So organizing a ball. So lots of opportunities there. The psychology seminar series. So in semester 1 and 2, we have external speakers, as well as a few internal speakers come and talk about their most up-to-date research. So really great for learning about developments within psychology, both internationally and nationally. There's also opportunities for employment as a graduate teaching assistant. Graduate teaching assistants are typically engaged in marking at first and second year on the BA psychology. So you'll be able to get paid to do marking. So you get trained, full training, and then paid for marking on certain of the first and second year classes on the BA psychology. So again, a great opportunity to develop skills and to put something, to earn a bit of money, and also to put something on your CV. Yeah. And then also we have a real focus on employability. So whilst we cannot offer volunteer or placements, we do support students in applying for, finding and applying for volunteer posts, even jobs. So we write references for people. On occasions, we also get informed of job opportunities. So charities and organizations contact us to say we're looking for, an assistant psychologist. We're looking for somebody to, engage in, some sort of therapeutic work, etc., with full training and things. So we're then able to advertise those and encourage our CHP, clinical health psychology, so it'll be abbreviated to CHP, our CHP students to apply, and we support them in the application process for that. Okay. Final slide, university support opportunities. And this is where I will have less knowledge other than to know that they're there. They are a great source of support and can do really great things with you, but it's down to you as, as members of the CHP community to seek out those opportunities and take full advantage of them. There's the student association or the student union, lots of societies, lots of opportunities for social activities, for career, for skills development, etc. So you'll automatically become a member of the student association. So lots of opportunity there. The career service, and you get access to the career service for, is it up to 5 years post-graduation, Sammy?
I believe so, yeah.
Yeah. So even after you've graduated, you've got up to 5 years. You can come back to the Strathclyde Career Service and ask for support for, careers development, what opportunities there are, et cetera, but they are there. And the member of staff who is allocated to our department, she actually comes along and gives a talk in the interview skills module, the interview skills block for introduction to psychological therapies. Yep. So we bring her in. She gives a talk about interview skills, both for both professionally, but also, for sort of for when you're applying for your next jobs. There's funding opportunities for, if people fall into hard or challenging times, as well as for scholarships, etc. There are funding opportunities available through the university. There's English language support through the university for international students, extensive support available there. And they run in sort of in weekly, or not weekly blocks, but they have blocks of support. It's both online and in-person support available. You've got study skill support, and then the well-being service. So accessing things like counselling and mental health support, getting sort of assessments for reasonable adjustments. So some people may have a reasonable adjustment that means that they are automatically entitled to an extension to deadlines, for certain considerations in the teaching and learning activities, etc. So the well-being services can help support you through those matters. Possibilities for the future, I've alluded to some of these: doctorate in applied psychology, PhD, assistant psychologists, voluntary paid roles within charity and third sector organizations, the clinical associate in applied psychology, and other career options that some of our graduates have gone on to. This is the page where there are hyperlinks that might help you. So that's why I'll make the slides available to you. Where there's the asterisks, there is the requirement for graduate basis for chartered membership with the BPS. Okay. Anybody who does a BPS accredited undergraduate degree in the UK will automatically get this. International students, there is a way to go about achieving this without having a UK-based degree. And there's the link to the support here. You can see when I've hovered over that, there's a link that comes, a web link that comes up. That will give you the support, the way in which you can go about getting graduate membership of the BPS, but also graduate basis for chartered membership, which will then allow you to go on to pursue further training in clinical health counseling, neuropsychology, or clinical associate for applied psychology. Okay, that's me. That's the email address that I referred to at the beginning, has-chp-program-lead@strath.ac.uk. Okay, so I'll leave that there just a minute in case you're wanting to write it down. but we'll go to the Q&A. Sammy, is there any outstanding Q&A items?
So I think most of the questions we hopefully have covered in the presentation there, but if anyone needs any clarification or if you've posted and you'd like anything further, pop a wee message in. Having a wee look through them. We do have one wee question about entry requirements here. So is it absolutely necessary to have a research component in your undergraduate degree for this course, or is it possible to work around that? So my understanding is you do need to have evidence that you've completed a research project comparable to a dissertation or a thesis during your undergraduate degree. There have been instances in the past where obviously we understand, as particularly overseas, that not all institutions offer the possibility for you to undertake a dissertation as part of your degree programme. So we have in the past been able to consider applicants who have like a research-based internship experience, but that would be on a kind of strictly case-by-case basis, and we would look for you to evidence that you've completed research as part of your internship and that you've had like a written output like comparable again to a dissertation or thesis at the end of that. But if you've got any questions at all about the content of your undergrad degree, usually we can check your transcript and it's kind of evident from there the content that you've covered. But if we've got any questions about that at all, we will just ask if you're able to provide like a detailed course syllabus or module descriptors, and even just a wee bit of detail about the research that you've undertaken, and we can let you know if you would likely be suitable or not.
Yeah. And the reason why this is through experience as well, that the reason why we insist on research experience is that in the past, when we were sort of finding our feet, particularly when we were sort of learning about what international sort of undergraduate degrees did, as part of their curriculum, people had joined us, very small numbers, who really struggled with the dissertation because they didn't have that prior research experience. Okay, and that's where I said at the beginning, we want to make sure that that it's fair to allow you onto the program, so that that you have the necessary exposure to the knowledge and skills required to build on for this program. And given that the dissertation is worth a third of your overall master's degree, yeah, we have to, we don't have the time to develop those research skills from scratch. We have the time to strengthen them through the taught elements and through supervision. So that's why we want to have, we insist on research experience in the form of a dissertation, because that's independent. Yeah, it's independent research. You have probably 95% of what you do for a dissertation is your own work. The 5% is based upon feedback you might get from a supervisor. Yeah, so it's demonstrating that you can do research, that you have the knowledge and skills to do research, and then we can hone them and refine those skills. People who don't have that background are already at a disadvantage. Yeah, and whilst we have in the past done our best to support people to develop them, it's not always a guarantee that we have to get through this stuff quickly, because it's a 1 year full-time course. So that's why we insist on a dissertation. And then, as Sammy said, on a case-by-case basis, it may be, what research experience you have, but that will need to be a very significant independent research experience, as opposed to a collaborative experience, okay, where you are doing only part of the work. Okay, so that's the issue there, and the reason why we insist on that particular criterion. Yeah, so that you're not disadvantaged when you join us. I'm just looking very quickly through the questions here, so I can see that we've got 10. I'm just going to work from the top. So the first one was, is it a big jump from psychology undergraduate course? Yes, just as any master's degree should be. Yeah, it's not just if you're from England, it's not the 4th year of an undergraduate degree, because it's 3 years in England, and if you're in Scotland, it's not the 5th year of a 4-year undergraduate degree. Okay, it's a complete step up. There's obviously, you are then supported to make those changes to the way in which you approach the learning. So at master's degree, at postgraduate level, you are expected to be more independent than you were in your final year of your undergraduate degree. So you will see that a lot of time allocated to to your study on the MSc is independent study. Yeah, there's a lot of materials and support, weekly set like tutorials or lectures or workshops that can be from an hour to 3 hours. Yeah, so I've seen another one elsewhere. There's about contact time. I've addressed the contact days. Contact time can be, from an hour's tutorial for some classes, and then a 2-hour workshop to a 3-hour workshop and tutorials. So it changes class by class, but there is contact every single week, and there is on-campus contact. Okay, but it is a big jump because you are expected to engage in more advanced cognitive abilities. So rather than just describing, we're expecting you to analyze. Rather than just compare and contrast, we're expecting you to create and apply your knowledge. Okay, so it's a step up from your final year of your undergraduate degree, which requires some. So if you've got a first class at undergrad, that doesn't automatically lead you on to getting a distinction at postgrad. Okay, so just so there's a mindset around this as well. You need to put a lot of energy and time into it. That's why I said it's like having a full-time job. That's the expectation from the university in terms of the number of hours committed to guided and independent self-study. Yeah, so there's a lot of guided materials and guided study opportunities, but there's also an expectation that you explore some of the issues in your own way, in your own time. Okay, which is typical for master's level study. There's about voluntary opportunities. I've mentioned that we cannot offer voluntary opportunities, but we support students in finding opportunities and then applying for them and securing them. Researched on that. What should we expect in terms of workload for this MSc? So I will say the university says that for every credit of a class, that equates to 10 hours of study. So we've got 20 credit classes. That means you must do 200 hours of study across the class. That includes working on your assessment. Okay, that's the university stipulates that. Okay, we try to aim for something in around half of the time allocated. So at least 10 hours, I would say at least 10 hours each week should be expected to be spent on study per class. Okay, so automatically there are 3 taught classes in a semester. That's 30 hours. And that includes the materials that are available on MyPlace, the virtual learning environment, the tutorials or seminars or web or workshops, and also your independent study. So at least 10 hours to capture everything you do for each of your classes. So 10 hours for clinical in semester 1, 10 hours for introduction to psychological therapies in semester 1, 10 hours for research methods in semester 1. Okay, that's the university guide. Okay, so classes on campus. So I've dealt with that issue. When should we expect to hear about summer dissertation topics? Summer dissertation topics are probably going to be the week before the first week in September. Yep, so the sort of like the week before welcome week. Then you'll be expected to make your decisions and submit them. And then by week 1, so you have welcome week is the equivalent of week 0. Week 1, when we start all the teaching, that's when you'll be informed of at the latest, when you'll be informed of your dissertation allocations. Okay, so it will be towards the back end of the summer break, just before the start of the new academic year. Is there a final deadline? I can see Sammy's addressing that one for applications.
Yeah, I think just for the benefit of the recording, because I'm not sure if anyone watching it back will be able to see my answer, but yeah, there's no published application deadline, but we would encourage you to submit as soon as you can, particularly if you require a student study visa to study in the UK, so that you've got plenty of time for us to issue your CAS and you to make the necessary arrangements to join us by the start of term.
Yeah, thank you, Sammy. When will students receive their finalized timetable? The timetable will be released on the Monday of welcome week. Okay, so it will be released via the MyPlace the My Place page for the program, and then during the induction in Welcome Week, where as many of the staff that can come along do, and then they talk about their individual classes, and you get an overview, a more detailed overview of what I've just gone through, yeah, with some more details, etc. The finalized timetables and assessment deadlines, etc. That will all be finalized for Welcome Week, yeah, and it will be released on the Monday of Welcome Week. That's what the student union have asked us to do, is to open our My Place pages and make all these materials available on the Monday of Welcome Week. Okay. Can you explain a research-based internship and what does that mean explicitly for you? So I think I've alluded to there. If you know, a research-based internship might be, you know, if you've secured a summer internship and you've done a piece of research as part of that internship on your own and then written it up. Okay, so there has to be some written evidence of you having done that. Then that would be, you know, an internship. You know, this summer, a colleague and we've just applied to the BPS for a summer internship to work with a third-year student on our BA psychology for an 8-week project. They'll be doing research and then writing it up at the end. You know, so if they didn't, they're going to go on and do a dissertation anyway. But if they didn't have a dissertation, that might be, and I only say might be because it depends upon what the write-up looks like, what the nature of the research is, you know, and even the quality of that research. Is it empirically robust and rigorous? Yep. So you can do a research internship, but it has to be empirical, and it has to be of, you know, good quality. Which, if you did a dissertation, the quality of the research project will be indicated by your mark. Yeah. So if people did a dissertation and failed their dissertation, they're unlikely to probably fail or pass the overall degree. But that would raise some questions about an individual's ability to do research. So it is not just about have you done research, but what is the quality and the degree of independence. Yeah, so you must have driven or led on this research, not just been one of a group of 5 people, including staff members, to have done something. Okay, but more about that, you can contact us for more guidance if you've got an internship in mind, or if you've got an internship lined up. Because I'd be more than happy to suggest what you might need to do as part of that internship to try and, you know, create something that would be acceptable as an entry requirement for our CHP. Okay, and so we'll help you in whatever way we can, you know, for that. So just get in contact. For the research module, use SPS, Jamovi, or RStudio. So we don't do statistics; it's research methods. Okay, so we assume that you've done statistics at undergraduate. The application of statistics is in your research dissertation module. Okay, so we focus on research methods as opposed to data analysis. Okay, we do look into thematic analysis because my experience and understanding of the majority of undergraduate degrees is that they're very statistics heavy and relatively light on qualitative. So we do focus a bit more on qualitative analysis, and you get the opportunity to implement some of the steps in Brown and Clark's thematic analysis to develop codes, and from those codes develop themes. Remember, that's part of group working. So you work with your group and you're learning from and with each other. But we're not focusing on data analysis for the research methods module. It's about methods. Okay. Is there a capped amount of hours for supervision over the course? For dissertation supervision, typically dissertation can be group based, yeah, where we get a supervisor will get all of their dissertation students together when appropriate, because some sessions you're saying the same thing over and over, so you might as well bring more people together, and then there will be individual supervision sessions. The university does indicate to staff a maximum number of hours that we can allocate to supervision. But it doesn't matter if I say that to you, because staff, you know, very rarely do staff stick to that. They often go over. So it doesn't, you know, so we go over and above what the university expects of us. Okay. Staff are typically available to support you as and when you need it. And don't forget, supervision can occur not only in terms of on-campus group or individual supervision, it can be online calls, it can be emails, so there's various ways in which supervision can take place, both synchronously and asynchronously, both in person and online. Okay. And staff would rather do what's needed to support you than just stick rigidly to a set number of hours and then just go, well, that's me done. Okay. Do you provide students with a marking rubric? So yes, when we open up the class pages, so at the beginning of semester 1, all 3 of the taught class pages, clinical, professional practice, research methods, the materials will be made available, including all of the assessment materials, the briefings, the marking rubrics. We have briefing sessions. They can be in person, they can be online. There's additional sessions that are put on. So there's lots of support for the assignment, and you'll see exactly how your assignments are being marked. So what we do is we have a rubric where there'll be a series of criteria, and then there'll be, sort of like fail, marginal fail, pass, merit, distinction for each criterion. So each one of those boxes will be colored. And then at the end, in line with university policy, we give 6 points of feedback, or up to 6 points of feedback, which includes feedback, so what you've done, and what you could do to improve, so feed forward. Okay, so that's what we do. And you'll see each one of those marking sheets and the rubrics for each class as soon as the semester starts. So for semester 1 classes, you'll see all of that material for semester 1 classes when semester 1 starts, and similarly for semester 2. Okay. Is there any key course textbooks that you would recommend getting? Nope. What we tried to do is we tried to limit the requirements for you purchasing anything, because we know that it's tough enough times out there. You've got your course fees, accommodation, travel, so we limit that. So everything that you need, we try and ensure that it's available through the library. Yeah. Textbooks, one thing to remember about textbooks is they have a role in some places, but as soon as a textbook is published, it's out of date. Okay, so we try to make best use of peer-reviewed journal articles and more up-to-date evidence. There will be reference to chapters from textbooks, or an individual class may have a textbook identified as a potential resource for you to tap into, but none of the key, there's no expectation that you go out and buy books. Okay, because we don't want to put that further financial burden on anybody, because that could be a barrier to people engaging with our program. Okay, so I think that's me covered all of those questions now. It's just gone 1 o'clock. I mean, if there's anybody who wants to unmute themselves and ask, I don't know if they're able to do that. I'm happy to take any more questions, or if we have to stop now, then I understand that we'll have to, because it's encroaching on your lunchtime, Sammy. So I don't want to.
No, that's fine. I will say as well, I know Damien had popped up the email link if you've got any questions specific to course delivery, but if you've got any questions related to admissions, I will pop a wee note. I'm not sure if you'll be able to see, but it would be HASS, so HASS-PGT-admissions@strath.ac.uk. I'll pop a wee note of that in case you want to copy and paste that as well, but feel free if you've got any questions to fire over a wee email, and we'll get back to you as soon as we can.
So I will, Sammy, I will send my slides through to you, or is it to Moira?
Either or should be fine.
And then they can be made available along with the recording. And then we'll keep a lookout for any emails coming in.
Perfect. Well, if no one's got anything else, then we can wrap it up. But thanks all for coming, and we'll be in touch to follow up with that information.
Yeah, thank you everyone, and thank you for your time and your energy and your interest in the MSc Clinical Health Psychology. Look forward to seeing you in September. Bye-bye.